Guys, in the following video, you're going to see me go ahead and put fat graft inside the foot. This person had metatarsal or fat pad atrophy. She's close to 80 something years old, and she has a lot of pain. She doesn't have much fat on the bottom of the foot, right here at the ball of the foot. So what we can do now is actually inject fat tissue into there, and it can last you 6 to 8 months. A little bit of local anesthetic, and then we inject that fat pad in there. It's awesome. You'll see the results immediately. This is a liposauna 1 to 1.5 cc. Each one of these are for one supplement, usually. So I went ahead and did a PT block already. So use a block. Now you can do a block locally right here. The company asks you to do a local block, but I like to do the PT block. It's easier for the patient, easier for us, less pain. So made a circle around where I need to hit my target tissue. My entry point is marked as an X. I'm gonna go ahead and prep. I'll give a little local anesthesia just in case. I'll put more approximately. How you doing? Any pain? Good. So she's numbed already with a P block, but I just do one just in case. Okay. He's just gonna give me another one for the other side. Now I'm gonna go to the sauna right here. This is the vial. I'm gonna go ahead and draw it up. Make sure it's tight. Right here. Fatty graft. Very smooth. Very smooth. Okay. Right here. Fatty graft. Protects without the spray anywhere. Exactly 1.5 cc's, as you can see. Okay. Grab me a fresh 18, please. No, actually, I'll use this 18 because I'm gonna use that. I'm only use this one to draw. I'm gonna use this one to inject. Okay, she was bleeded out, prepped already. Any pain? Right here it says no fat. Right here. Over here, same exact thing. Some metatarsal 2 has that lesion right there, very painful. Again, PT block, hyperemia. You notice that? You can relax this, so you can relax a little bit. Okay, dear. This is a very good patient of ours, came in with a lot of pain, some metatarsal 2. So here we're going to go. She's already number 8. I'm going to go enter the right behind here. 1, 2, 3, bevel up. We'll go ahead. Sort of act like a little dissection right here. I'm just going to dissect. You can see my needle, dissect underneath. Okay, we'll go central, dissect. And I'm going to go do a little dissection right here. So free up some of the soft tissue. I can feel my needle underneath my hands. Dissecting. Now we're going to go start injecting this. Feel anything? See you fill in right here, pull out, fill in more, pull out, fill in more. Where your needle ends, fill in more. Underneath this, two, fill in, fill in, fill in. Now right here, I'm gonna put pressure here as my needle packs out. Put pressure for a little bit. And that's about it. As you can see the fat pad right here, make sure it obviously doesn't have TA, make sure there's no infection. But otherwise, now she has a nice fat tissue. This was injected within the subcu, not in the dermis, right below the dermis. I'm going to keep pressure for about 5 minutes. Protocol is we're going to go ahead and put a Band-Aid on there a little bit later on, get her surgical shoe. I'm going to put a felt pad behind here so she can walk on her foot, but not put pressure on this new fat we injected. So you see, after the dissection here, this fat stays around that area. So I dissected with the needle, and the fat will stay at the area where I dissected. So it's very nice. Her body's going to have a little inflammatory reaction there. It will incorporate this fat. It'll last for about 8 months, this graft, but you'll also still have some residual fat left in there, like a fibrous tissue. So it won't return to where you were before. You'll still have the cushion there. So when we repeat it, it's really up to you how the body absorbs and how you feel. Okay?
So it's about 8 months.
8 months is the actual graft itself, but your body's going to form an inflammatory reaction, can form a scar tissue too. So you're going to have some natural fat there too.
Okay.
So, yeah.
So I'll come back and see you in 8 months or whatever.
Well, we'll make the plan for that. You're going up north, so I'll see you when you come back next season.
Yeah.
We'll take a look at it and plan. Sounds fair? Okay. Everything looks good. That's it. Thank you.